Thank you, Mr President. My question is to the Minister representing the Minister for Health, Senator Nash, regarding the open letter sent to the Prime Minister this morning, signed by more than 70 mental health organisations, which says that the funding uncertainty plaguing the mental health sector has now reached crisis point. Has the Minister been briefed on the number of people who no longer have access to mental health services because of staff attrition and service wind-down caused by the government's failure to guarantee funding for vital programs?
The Assistant Minister for Health, representing the Minister for Health, Senator Nash.
Thank you very much, Mr President, and I thank the Senator for her question. And yes, I am aware of that, and indeed the Health Minister is also well aware of that. She is highly conscious of the need for funding certainty and is indeed committed to working with the sector to make sure we have that frontline service delivery that we need. That is a matter of consideration at the moment for the Minister, and I know that she is hoping to conclude that deliberation in the very near future. But I might add for the Senate, Mr President, particularly when it comes to rural and regional areas, and I know this is an area of concern for those on both sides of the chamber when it comes to mental health provision, is that there are a number of programs that this coalition government are already implementing to ensure we get the outcomes that we want out there on the ground. Indeed, we only need to look at the mental health services, rural and remote areas, where we've got $16.7 million going out to around 200 communities across rural and regional areas that otherwise wouldn't get services. And indeed, Mr President, programs like the National Suicide Prevention Program, where we have $9.2 million.
Senator Wright, a point of order.
Point of order, Mr President. I specifically asked the Assistant Minister as to whether or not the Health Minister has been briefed on the number of people who no longer have access to mental health services as a result of the funding uncertainty. It was a specific question, and I'd appreciate a specific response.
Thank you, Senator Wright. You did ask that question, and the Minister up front said, yes, I and the Minister are aware, and I take that to be an answer directly to your question. The Minister is in order. I call the Minister.
Thank you very much, Mr President. And as I was saying in relation to the National Suicide Prevention Program, there's $9.2 million going to 23 projects, predominantly in rural and regional areas, to address what is a very important issue for people, not just in rural and regional areas, but right across the country. The Coalition is well aware of that and indeed currently have programs in place to address that, and will be working through the issues that the Senator has raised.
Thank you, Minister. Senator Wright, a supplementary question.
Yes, thank you, Mr President. I query whether the government actually understands the depth of this crisis. These organisations need to give notice to staff who may lose their jobs.
Order on my right. Order on my right. Senator Wright, you have the call.
Who may lose their jobs if funding is not renewed in the next few days. How many more days is the government going to make people wait to find out whether they will be out of a job and these services will not be continuing?
Minister.
Thank you, Mr President. As the Senator would be aware, this funding agreement runs to the 30th of June. As I indicated in my first response, Mr President, the Minister for Health is very well aware of the need for certainty around these issues, and I do have to respond to the Senator's comment saying that the government, she doesn't believe, is aware of these issues, a fully understanding of these issues. The depth of these issues, indeed, I'll take that interjection from Senator Wright, the depth of these issues. Of course we are. This coalition government is more committed to mental health in rural and regional areas, and indeed right across the country, across the whole nation, than we see from those opposite, Mr President. And to indicate to the chamber, from the Senator, from the Greens, that we don't understand this issue, the depth of the issue, is completely misleading from the Senator. We absolutely do understand the depths of this issue, and the Minister will continue to work through to resolve this in a very timely manner.
Thank you, Minister. Final supplementary question. Senator Wright.
Yes, thank you, Mr President. The programs at risk here are literally life-saving services that in many cases provide support to people who may be considering suicide. Given that 6 Australians take their own lives each day and suicide is now the leading cause of death for young Australians, does the Minister agree that any loss to services could potentially have life-threatening implications?
Minister.
Thank you, Mr President, and I will just reiterate for the senator that this is an issue that is being worked through at the moment. The minister realises the importance of this issue and is hoping to conclude those deliberations over the period of time. But can I just say, Mr President, it's indeed this coalition government that's focused on mental health, particularly in young people. Indeed, we increased the Headspace sites that everybody around this chamber would know have been so effective to 100. Indeed, 46 of those are specifically targeted for rural and regional areas. One I was visiting just recently up in Coffs Harbour, and they do a tremendous job. So indeed, Senator, this government has a very real focus as a priority on youth mental health. When we've got 1 in 5 people across the nation every year facing a mental disorder, it is absolutely right that this coalition government has this issue as a priority, and particularly for how it affects our young people across the nation.
Thank you, Minister. Senator Williams.